We saw the number of patients per day per therapist jump to 20 patients per day in some practice settings this year, which is higher than it has been. On average, it's been somewhere in the 14, 15 range. And so that's a pretty significant jump in a shorter period of time. Not unheard of, and with the right sort of, technology and perhaps, processes that are in a practice with ancillary staff assisting, there's no reason that you couldn't do that. But that's a big jump if you don't have those things in place. 70% of the respondents were considering a professional change. So definitely burnout has something to do with, this uptick in dissatisfaction, I guess, and this difficulty with employee burnout as well as the employee retention. We also saw numbers like 14% citing they're considering moving to a non-clinical role. I can just say anecdotally here at WebPT, we have had by far the highest number of PTs who are applying to non-clinical positions within our organization. Just this year alone surpassed the number of PTs that we've had in the history of the company. So it's definitely an issue of people trying to figure out, did I choose the right profession? Is the profession going in a direction that I thought and think it should? And frankly, I mean, as just like everyone, right? The pandemic had a lot to do with that as far as changing in how you are able to do your work, sentiment of patients, and just the burden of on the organizations that are running these practices as well.